I started Hope Assistance Local Tradies in 2013 after the suicide of a local tradie. It was at the wake and we were discussing all the things that were going on for people in community. The two words that kept coming up in conversation was, who's next? And it was like, is that the best we can do, is talk about who's going to suicide? We need to do more. I've come along to Total Tools because we're doing an event here tonight as part of the Northwest Melbourne Primary Health Network and HALT collaboration. So it's a perfect chance, it's a place where they feel comfortable and we're here to actually help them access services.
The Melton and Brimbank suicide prevention trial is part of 12 trial sites across Victoria. We're working with a really diverse community to reduce the impact of suicide that they're experiencing. We've got a real focus on building the capacity of the community to recognise when somebody is at risk of suicide, start to really challenge some of the stigma associated with suicide, and through that, making sure that the service system is equipped to be able to respond to people when they are help seeking.
So the meeting today was the Melton and Brimbank Suicide Prevention Network. So it's getting the funders, the service providers and different community members to come together and go, this is what we're seeing and this is how the community can work on it.
I think the greater goal is that we would see a more connected community who are able to engage with one another and respond to suicide ideation in a more effective manner. We all have our roles to play in that. I've been a mental health practitioner and that's certainly an important one, but it's not the only one. And I think that's what this network envisions well.
So my name is Natalie Burns and I'm a clinical social worker and I'm here today in Melbourne training mental health professionals. So historically what we know is that when an individual is experiencing suicidality, that the traditional approach is to hospitalize, and we know that that just is not effective. And so the CAMS approach is really to say, let's treat this on an outpatient basis. Let's join together with the patient, the client and the therapist to figure out how we can address their suicidality in a collaborative nature.
I guess when I was completing the training, one of the things that I realised is that as a clinician, I never spend 12 consecutive sessions working on suicidal thoughts and drivers. This training and the setup, they make it very direct, provide a very clear agenda that this is what we're working on and this is how we're going to save your life.
Suicide is a really challenging conversation, but through this trial, we're putting it on the table. Talking about it is going to make it a safer place for those that are experiencing suicidality.
We're making a difference. Tradies are starting to talk more. So yes, I believe it's changing. I still believe it's a generational change, but we're starting the conversations.